Morning again, everyone. I'm Karen Robertson, as you all know, and we're here for our board meeting today, and I'm standing in for Miss Leanne as she's traveling on business out of town and is not able to join us. So we'll go ahead and call the meeting to order at 8:33, Veldy. And I think for the sake of virtual, we already have roll call established. So I'd like to get an approval of the agenda, which we can't do officially in terms of a vote, but everyone has the agenda there with them. Are there any questions about the agenda or any items that you all see that need to be added? Thank you for that, Vildy. Okay, well, let's go ahead and move forward into the coordinator's report. Turn it over to you, Vildy.
Okay. Again, good morning, everyone. We thank everyone for joining us on this bright October morning. We have just a few things to update you on how we've been kind of continuing our work here through our collaborative, even during the challenging times that we found ourselves in. I generated a one-page report just to kind of give you an update, a visual of just the main things that we've been doing over the last 3 months and actually over this last year. With our First Steps program, our contract year for FY20 ran from October the 1st through September 30th. So it ended yesterday. The projected families that we were contracted to serve was 150 families, and we actually met that goal by serving 150 families this year. Just a breakdown of those families that we had 110 of those families were mothers with actual children that was birth through age 5, and 40 of those were expectant moms. With that program, our goal is to really provide resources and services to families to make sure they have health insurance, to make sure they have a primary care physician, and then on top of that, to give them information and resources to provide safety and information about how to make sure their children are and families are strong during that early childhood year. And so to break that down, we had for the families that had already had a primary care physician, that's one of the questions that we asked. 122 already had a primary, and this is the mothers, 122 already had a primary care physician, and the other 28 received a referral on how they could go about connecting with the primary care physician. For children, we had 86 that already had a primary care physician, and of the others that were not connected, those 24 did receive a referral. We asked also, we kind of gauged how many have health insurance. 126 of the mothers already had health insurance, and of the 24 that did not, they did receive a referral. And of the children, 88 already had health insurance, and 22 received a referral. Our enrollment strategy, of course, has changed since we have been in this pandemic. And we do virtual enrollment now and have been since March. And the way that the packets are given out, again, those parent packets contain information on home safety, environmental safety, maternal health, child health, all of that goes into that parent pack. And the way those have been delivered is either via mail or hand delivered, where our coordinator meets with the parent at a designated place and gives them the packets. And actually coming up as we go into the new contract year, the state office have actually developed a virtual parent pack, and basically it's a one-pager, and it has different links under the different categories that we stuck inside the pack. So there'll be a link that has home safety, and then the parent can just click on that link and it gives them resources and information about how to child-proof their home and how to gauge in a fire safety plan and things like that. So that's because they expect us to be virtual for a little bit longer, at least into the early FY21 year. As we go out, again, our new contract year started today, October 1st, and it will run through September 30th. Again, we have the projected families to serve 150 new families in addition to the ones that we've already served. And actually, this is probably going to put us over 1,500 families that we've served over the last 5 years. Our enrollment strategy will continue to be virtual on some aspect, but our coordinators also reaching out to our local food pantry because they have a distribution every week of how she can reach out and partner with them to enroll families, as well as trying to establish a renewed partnership with the health department. A lot of our referrals originally were coming from the health department and the WIC patients, families that were seen there. But as of mid-September, I know that the families still were not being served inside the clinic, the WIC families. So trying to work out a strategy of how we can still reach those families and get them enrolled in the program. And also partnering with the school to reach out to teen parents through our school nurses and school counselors. So that program, we ended right where we wanted to end up at as far as our service delivery, and we're excited to go into the new contract year. Our Parents as Teachers program is another program that we oversee with Family Connection. It has the same running contract year, which ended yesterday. Our total proposed families that we were to serve last year were 18 families, and we actually served 18 families. Proposed monthly caseload was 15 families, and we did average 15 families throughout the year last year. And the total numbers of children we served was 31 children. The demographics of that program, there is 100% Hispanic families. The 72% of those families are single. 78% of those families have less than a high school education, and 96% of those families have an income less than $20,000. And again, this program is designed to serve families that are more at risk and making sure that their children receive and families receive what they need, so that children are, one, safe, and two, that they are ready to start kindergarten successfully. The way that we've been serving families since March is virtually, and that includes our home visits and pretty much every aspect of the program. We've been seeing those families virtually. We were a little bit concerned that we would not be able to, how that would work, but families have actually stayed engaged and even more engaged with families, with the services over the course of the last several months. Over the contract year last year, our parent educator made 333 home visits. She conducted 12 group connections, one a month, which is like a support group for families. She made 129 referrals and did 49 developmental screens. Our new contract year starts, or supposed to start, October 1st, which is today, and run through September 30th. We are currently awaiting our executed contract from DHS, and we can't actually officially start contract services until we receive that contract, but hopefully we will get it within the next week or two, and she can start serving families. The projected family served, and that is incorrect. The projected numbers that we are going to serve this year is 21 families with an average caseload of 18. And we actually had to increase that number at our funders' request. They were indicated that because our parent educator was a 0.75 full-time equivalent staff member, that she would need to be doing more home visits. And the way that we would, in order to meet that request, we had to increase our caseload, which wasn't a problem because we had 6 families we have 6 families on our wait list anyway. And so when the contract year opens up, we'll just pull those 6 families into our, put them on our active caseload. So we will, again, start that program as soon as we receive our executed contract, hopefully within the next week or two. The last thing I want to share is our Baby Bulldog Early Literacy Initiative. I know we've talked about this for a couple of years now and gotten excited, and then things got sidetracked, and then this year really got sidetracked. But we are excited now because we are partnering with the school system on their district-wide literacy plan. They are actually writing the grant for the L4GA, which is a big literacy grant that is available each year. So they will be applying for that grant for this coming year, which is due, I think, in February or March. And so our first meeting is going to be October 20th at 1 o'clock over at the Board of Education Board of Education building. And with that, with our portion, the Family Connection portion, is we're going to be developing and overseeing the birth to age 5 portion of the initiative. And so basically before kids hit school, our role is to help make sure that they have what they need in order to start school successfully. And so our Children Safe and Family Strong strategy team is going to play a huge role in the development and implementation of that particular portion of this initiative, because again, it's all about making sure all students are ready to start kindergarten successfully. And in order to do that, what we're going to really focus on is how can we connect families with the school system. And this is families before they even hit the school's doors at age 5. How do we already connect them to the school system and to the Department of Early Care and Learning and other community partners to make sure that they have appropriate milestones. Parents know what the milestones are. They know what to look for. They have access to books. They have access to other resources that help to make sure that their children are ready to start kindergarten when the time comes, as going to be indicated on the DKIRS and other entrance exams. So I'm excited. We've been doing a lot of talking about this, but actually now we are partnering with the school system in order to be able to pull together a very strong plan. And hopefully, prayerfully, once the school system actually receives that grant, that we will also have this portion written into it and can have some backing and support and even possibly, hopefully, some funding to help make this possible. Some of the things that we're looking at in order to make sure that those kids have and families have the resources they need is the like annual class reunions, where we pull together class reunions for the kids under age 5. And it's during that time we make sure that they are connected to resources that they have. We give them the milestone templates and we do different activities with them so they will know, and the school system will be there and DECAL will be there to help make sure, again, parents have resources in their hands so they are guiding their kids with age-appropriate resources and activities to help ensure that they are ready to start kindergarten. So we're excited about that and look forward to that actually being kicked off as we go into 2021. The only other thing is our family connection meetings. We still are holding all of our meetings as we're doing now virtually. One of the reasons is because, again, I only have a small office space and can't pretty much social distance in the office space. And like the school system, which is where we held some of our meetings, they are not allowing right now outside groups to come in and meet. And so I haven't heard back from the church yet on outside meeting, but I'm sure they also have limitations on large groups coming in and meeting there. So right now we are still meeting virtually. Our October spotlight for our October collaborative meeting will be the Madison Morgan Food Pantry, which is a new food pantry that is now being housed over, I think, at the old middle school. And they're going to come and share kind of what they're doing and their food distribution and how we can partner and expand the awareness of that program. As well as November spotlight is coming from Kate Davis of the Northeast Georgia Goodwill. And so she'll be talking about some programs and services that she offers here in our community as well, and how those have been impacted and through the last few months. So we look forward to our upcoming meetings and those presentations. And again, those will be held virtually. We will see how things go as we go into the new year and kind of where we are. I'm in and out the office. At the office there in Madison, I do a lot of work here at home because my kids are virtual students right now. And so, trying to juggle that and make that work has been an experience, but we're getting through it. So that's all that I have.
Thank you, Veldy. Does anyone have any questions for Veldy on any components of her report?
Yeah, I had one question, Veldy. I know you kind of touched on this, but what is your assessment of how the need to go virtual with so many components of our program? How is it affecting overall how you think our program is meeting our responsibilities? Not that we have much choice about it. But.
At first, it was a struggle trying to kind of get our mind around it. But again, like with one of our programs, the Parents as Teachers program, the parents really have dug in and reached out and to our parent educators just because it's exactly that. How do I teach my children at home? They're here all the time. What am I supposed to do with these kids? So they really dug in and reached out to her heavily. With one of our programs, the First Steps program, it's been a little more of a struggle because it's hard. A lot of hers came from, again, direct contact with the WIC families, direct contact with events that we had in the community. So she has been relying a lot on the first readers list and pulling families from there. but that list is not an endless list. So that's why we're reaching out to the food pantry on their weekly deliveries. It's been different, but I think now everyone has kind of, I don't want to say gotten used to, but have kind of adjusted to this virtual model. And, you know, each week as we're meeting, like our Children's Sake and Family Strong team has met virtually. So I think people are adjusting to it. We'll see again as we go throughout the final months of this year how we can, you know, possibly get back in person, and when we can get back in person to continue to work. But some of the things we just can't do virtually, like a lot of the meetings and things we just can't do virtually. That, you know, with Family Connection has always been that face-to-face, that networking that you kind of miss out on Zoom meetings, that those little conversations on the side that people get together after meetings and make things happen. Oh yeah, I like that program. This is what I'm doing. We miss out a lot of that. So but we'll see.
Appreciate that. Thank you.
Thank you.
Thank you, Veldy. Thank you for that important question, Councilman Joyce. I think we're all trying to adjust and do the best that we can with virtual and remain as safe as possible for ourselves and our stakeholders. So we appreciate that. I'm looking at the agenda and board consent agenda items. So I guess we're going to move right into the reports. And Pam is not here with us. I'm trying to look at the documents that were sent out. I guess at this time, we just need to review the 2021 board meeting dates and times, as well as look at whether we'll have any openings on the board and officers. And I'm assuming some people are coming up, Veldy, to roll off the board perhaps. Let's see. I'm trying to pull my document just to make sure I didn't overlook.
Okay. Can you see this on the screen? Hello?
Yes, I can see it. Can everyone else see the document? Okay.
Yes.
It looks like I'm in the witness protection program. Who should I be sending my contact information to?
You can send it to me, Councilman Joyce.
All right. Veldy, thank you.
Okay, so as we're looking at it, we do have a couple of people who have terms that are going to end in 2021, but I'm assuming that that won't expire, Veldy, until June 30th?
Yes,
fiscal
correct.
year? Okay.
Yes.
So I'm sure Pam is going to be working on possible replacements for those because they are every 2 years. And I know we have the bylaws and I'm not certain about continuing serving if you've served so many terms. So I don't want to get into that because I'm not the governance chair. Man, I'm just filling in for Leanne, so I don't want to overstep my boundaries, but just making everyone kind of aware that we have 1, 2, 3, 4 positions that are up for expiration on the board in June of 2021. That will include Dr. Myers, Leah Ainsley with Public Health Department, Leanne, of course, our board chair who's with the Extension Service, as well as myself. So I'm sure we'll be working with our governance chair, Pamela Benford, to look at those positions over the next 6 months. Did we have a list, Veldy, in the attachments for board meeting dates for 2021? Typically, this board meets once per quarter out of about 4 times a year because it really only requires this board to meet to review financial reports and approve those when they're due to the Georgia Family Connection Partnership each quarter, which is why we've limited the number of times that this board meets and just encourage board members to participate in the monthly collaborative happenings and strategy teams. So I think our next meeting is probably in January, I believe, of this board. Okay.
Yes, it should fall on the 7th, but I have not looked at that's that first week of January.
when
And
the
so I
school
haven't looked at the school
returns.
calendar and all of that to see when everyone will be back. So right now it's on the calendar for January the 7th.
Okay, I think that they return on the 6th, if I'm not mistaken, but I could be wrong. So we can certainly look at that and send that out too, just so
Okay.
that everyone will go ahead and get those 4 dates on their calendar for those that, it's particularly for those that are going to continue to serve through 2022. You know, you can go ahead and put those dates on your calendar to ensure that you have them. They're always generally the first Thursday of that quarter, so that we're there to approve those quarterly reports, expenditure reports.
Correct. And so the next one will be April 1st.
April the 1st, correct. Okay. And they're always at 8:30, and we will TBD, if you will, or TBA about whether they will be virtual or in person, pending the status of our public health and our ability to return to regular operations. So I guess at this time, we'll just plan for virtual until otherwise is determined. All right, moving on through our agenda, looking at the Finance Committee report, Dr. Myers.
Hey, good morning again. Veldy, are you going to put up the combined one? There you go. I think it's pretty straightforward. Veldy put this together. It looks great. We finished the first quarter of the Family Connection grant. And I think Veldy's going to talk about that a little bit in just a minute as well, because there's been a change in the amount of the approved budget. So we have to make some revisions on that. But we've spent less than a quarter of the money in the first quarter. So it's looking good. First Steps is not a finished document here because we're waiting on Amanda's final payment invoice, as well as to spend some additional money, because we are going to have, I think, Veldy, you said about $1,400 that needs to be spent as well before we do our final report to the state folks. And then last is parents as teachers, and I believe it looks like we have a balance of $189.77. Is that correct?
Yes, that's correct.
So you're planning to spend that as well, I assume?
It is, well, this is actually the final report. I tried to get it all spent, but we still have that 189 in there.
Well, I think that's pretty close. It's hard without having to go over and spend money we don't have, right?
Yes.
Okay, that pretty much takes care of the 3 reports that we have, unless anybody has questions about any of those. I don't know what to do about getting approval. We don't have a quorum. Is that right, Karen? Is that what you're saying? So,
Yes, that's correct. So what we can do, Dr. Myers, is just email these reports out to the full board and push to get an electronic vote with a quorum from members of the board.
all right.
And I
Karen.
think this is due on the 15th. Yes, ma'am.
Yes, they are. Pam just joined us.
Oh.
Good.
I don't know whether she got in for the full report, finance report or not, but she did join us.
She's on mute, but good morning, Pamela. Thank you for joining us this morning. And if you can hear us, I think since we have our reports, I would like to ask, does anyone have any questions on the financial reports?
Good morning, Karen. I apologize for getting in here late.
No worries. We're just happy to have you present. We now have a quorum and we're thankful for you this morning.
Okay.
I would like to, since Pamela is present and there aren't any questions, I would like to call for a motion to approve the FY21 Family Connection Quarterly Expenditure Report for this quarter. If I can get a motion.
I so move, Karen.
Thank you, Councilman Joyce. May I have a second?
This is Pam. I'll second.
Thank you, Pamela, for that second. Is there any question or discussion? Being none, all those in favor of the motion show by saying aye.
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 All opposed, same sign. Or same sound. How about that? And the motion's been carried. Thank you all so much for approving those reports. And I'd like to take just a bit of executive privilege and go back and approve the agenda, if I may, now that we have a quorum. So if we can just double back to the top of the agenda for approval of that, which included Veldy's coordinator's report, also the finance report, and then following the approval of this, we'll go back and visit with Pamela for any updates she'd like to share on governance and nominating committee. I'll entertain a motion at this time for approval of the agenda.
I so move.
Thank you, Dr. Myers. Is there a second?
I'll second.
Thank you, Pamela. Any question or discussion? Being none, may I receive a vote? All those approved, say aye.
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 All opposed? All right, the motion has carried. So in order, Ms. Pamela, do you have any updates you'd like to share in regards to governance nominating committee? We basically discussed the board meeting times and dates for 2021. We talked about that being possibly January 6th or 7th, and then April 1st for the following meeting, and that a couple of people on the board will be rolling off June 30th. I think there's about four positions that will come off on June 30th of 2021.
Yes. First of all, I'd like to welcome Mr. Joyce to the board. I think this is his first official meeting. And I'm sorry I wasn't here earlier to do that at the beginning of the meeting, but I would like to welcome him, and we really
Thank you.
appreciate his support. There are four members that would roll off in 2021, and we still have one new member to confirm. I checked on it yesterday, but I wasn't able to resolve it. So in the next week or two, we'll work on getting Mr. Worrell confirmed and send that information out to you all through email when that's done. And we're, constantly looking for members to come on because we, due to the pandemic, everyone is pretty much staying on for 2 more years. So that would have come off this year. So we really need to beat the bushes and come up with a list of possible members to replace some of us that will be going off. So, and when is Team Mays? I can't get to my calendar. Let me see.
Typically in April, isn't it?
Yeah.
Yeah, she sent out the date. You have April 1st, 2021. I have it as a Saturday. Am I looking right? You said that was
I have April 2nd. Setup day is April 1st.
on my calendar saying it's a Saturday. Wait a minute.
April 1st is a Thursday. April 2nd.
Yeah, April 1st is the setup day. Yeah, April 1st is the setup day, and April 2nd is the Mays Day. And the first planning meeting is January 6th.
Okay. Usually that setup day is hard, and the 6th will probably be spring break. So the first may not be a good, could we move it back a week to March? March 25th. Would that be okay? If I'm looking at this calendar right, I'm probably looking.
I think it would just be at the will of the consensus of this group. At this time, I don't have any conflicts with that date. And I would just ask that the other members of the board would take a look at it, at their calendars for Thursday, March 25th.
Wouldn't we need Leanne input into that?
Definitely, definitely.
Okay.
Just trying to get kind of a tentative look from members that are present now to see about their availability, and then Leanne can confirm with Veldy.
Okay.
Yeah, both those dates work fine with me.
Yes.
Yeah.
And
I don't have a problem with them, no.
So January 6th, March 25th at the moment? Yeah, that's fine with me.
Okay.
so Pamela, will you get confirmation from Leanne and then communicate that with Veldy, please?
Yes, I will.
Thank you.
I will.
And the remaining 2 dates for the year?
This year?
2021, I'm sorry. We were looking
After,
at,
after the April date?
yeah, I was thinking maybe like in a July or August date or something like that.
Have we been meeting in the summer?
Well, I want to say there's a report that's due on August 15th of the year. So there's typically a need for us to meet in early August and then return again in October for approval of that quarterly report that's due at that time. And Velda, you can confirm I could be incorrect.
Yes, that's correct.
Well, I have it on August 5th already.
Okay.
And the calendar's not moving right today.
I have October.
October 7th.
Yeah.
That's correct. Yes.
I will, once I confirm with Leanne, I will see if Veldy type up the dates, or I'll type up the dates and send those out.
It sounds great. Thank you so much.
Okay. Thank you all.
Does that
And
conclude
please
your
confirm again, is the January meeting January 7th, correct?
Yes, that's what we said.
Okay.
And I already have a calendar reminder.
I do
Yeah.
too.
I do as well.
Karen, did you send that out?
I think it's been in place for some time now that I created a while back. So
Okay.
I'm just going to keep on welcoming y'all to keep coming on.
No,
You go back and add Mr.
I have 4 reminders on my phone. I don't know where they all came.
Yeah, Dr. Myers, I have quite a few in my calendar as well. They pop up 2 and 3 at a time for the same meeting.
Same day, yeah.
Yes. Pamela, yes, to your request, I'll go back and add Councilman Joyce to that. Yes, sir. Yes, ma'am, I will.
All right. And then when I get confirmation on the other person, we'll let you know about that as well.
Okay, perfect.
Okay.
Thank you so much.
Thank you. Now I can mute myself back.
We have one more financial piece of business.
All right, Dr. Myers.
And I assume, Veldy, you want to discuss the revised budget. Is that it? Yeah. You want to discuss what changes you want made in that budget?
Yes. As we know, earlier this year, the governor had proposed that all state agencies, and since we're funded through the state budget, be decreased by 14%. And so we built our original budget for FY21 based on 43,000. But towards the end of, I guess sometime earlier this summer, we were allotted back funding into our budget. Each state budget was reduced by 10%, and the state office of Georgia Family Connection is going to take 6% of that cut. And so we are the local agencies, local counties are getting 4% cuts. And so that will bring our budget back up to $48,000. Thank the Lord. And so we just need an official approval. This is my recommendation for how to bring our budget back up to $48,000 under regular operating. Just bring in because what would have happened was I would just be permanently designated working from my home office. But this allows me to be back in the office and also allows us to have some to be able to manage again that office space and everything that comes with that office space. Like we would say a part of Prevent Child Abuse Georgia, which is 175, our liability insurance that we have to have there in the office of $900, as well as the meeting room space that we have there. And we actually, thanks to the owner of the building, we only have to pay that meeting room space starting in January up until December 31st. He's allowed us not to waive that cost. The only other increase would be back under per diem fees and contracts, where my salary would go back up to where it is now versus being cut by the $1,400, and so we would add that $1,400 back in there. We also have already paid for the Georgia Family Connection Partnership conference, which is next month, so that was added back in there as well. The phone expenses, again, for the office space, the internet expenses added back in there for $1,500. So you have before you the approved current budget, which is in the white area, the proposed increase, which is in the purple, and then the difference you will see there in the kind of gold and yellow. And so we just need official approval. I have not received yet official word on when we would insert this back into our state budget, but I'm thinking it's going to come after we submit our first quarterly report. Once that goes in, then we'll get information to go back in and revise our budget. So they want us to go ahead now and get official approval for the increase, so that as soon as we get that information, we can put that funding back in our budget.
Okay.
That's all that I have.
Karen, do you make that? We need a motion to approve that revision, right?
Yes, and I just want to get clarification from Veldy, because I know we kind of had to go back and forth with this via email like a month ago, or whenever budgets were changing and the governor was adding money back in the budget. Was there a time frame that the executive committee had to approve these revisions a while back, Veldy, and so now we're ratifying this change that's already been completed with the full board?
What happened was when I got word that the budget was going to be increased, I immediately went in and adjusted and put a proposed budget increase together and sent it out to you all. But now they are asking in order for me to actually go into the actual, and you all may have approved it then, but they want us to actually.
I was thinking.
That's why I asked, because
it looked familiar for some reason. It's like.
Yeah, that's why I asked Dr. Myers, because I felt like we had either the executive committee had to go ahead and make a decision because it was time sensitive. But we can certainly go ahead and, for official purposes, call for questions and complete an official approval today for our records, for our minutes. And so I guess at this time, I'll go ahead and entertain a motion for approval of the FY21 budget revision as presented.
I'll move. This is Pam. I'll move that we accept the new budget with the revisions.
Thank you, Pamela.
Well,
May I have a second?
Sorry.
Thank you so much. May I have a second, please?
I second the motion, Karen.
Thank you so much, Councilman. Is there any other question or discussion? All those in favor of the revised budget as presented, kindly say aye.
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 All opposed, same sign, same sound. And the motion has been approved. So thank you, board members, for taking that official action. Dr. Myers?
Yeah, and it's not on the agenda, but Mel, did you want to talk about the invoices from parents as teachers? You wanted to give us an update on how that's going? That seems to be quite a task you've been assigned.
Yes, it does. I agree, Dr. Myers.
Yes, it has been a, yes, task is a, yes. Time consuming.
We won't use any other words on the.
No other adjectives.
The Parents as Teachers program is invoiced monthly, and the way it works is I generate the report based upon the services that were completed. I have to send a report to the Board of Education, which is our fiscal agent for that program. They have to sign off on the report, and then I have to send it back to our local DFAS office, to our local DFAS director for approval, who then sends it to their DFAS, regional DFAS, for payment of the invoice. Well, I found out late in June or early summer that the Board of Education had not received several payments for invoices that had been submitted. Like, I don't know, about 7 invoices had not been paid. And so that began the process of getting them done. So through a long process, I won't go through all of it, but through a long process, I received note on this past, was it yesterday? Sometime this week, that all invoices had been actually paid. I don't think the last 2 checks have been received by the Board of Education, but DFAS sent me information that those checks had been cut. So praise the Lord, all of the checks have been cut from regional accounting. So the Board of Education should have their all of their funds. Of course, we always want to keep, that is a concern, because they were asking, are we going to go, as we go into this new contract year, are we going to be getting payments on time? So I just had to assure them that yes, we will be getting them on time. So the process now will be, I will send the reports, the invoices, to the office manager at DFAS, as well as the DFAS director, because again, I know the DFAS director has been overloaded with serving several counties and just adjusting to all of this. So I will make sure that her office assistant gets the information as well. So we will see, we start invoicing again in October. So we will pray that this year will go much smoother than last year. And I will make a point of checking in with the Board of Education as well monthly to make sure, have you received your check, so that it's not 6 months behind the line and they haven't received 6 or 7 checks. So yes, it's been a process, but prayerfully we have everything worked out now where things will be received at a smoother fashion. So thanks, Dr. Myers, for checking in. But yes, they should have all of their checks by the end of this week or within the next week or so.
Well, thank you for working so hard to get it done. It was a lot of back and forth in emails for sure. So thank you for that. I believe that's all of my report.
Thank you so much, Dr. Myers. And thank you again, Veldy, as Dr. Myers said, for your diligence in overseeing that process. And anytime we have partnerships with grants and programs, there's always processes that we have to review ongoing to make sure things are running efficiently. So thank you for your stake in making sure that that happened, Veldy. And I don't use that word lightly, because you put a lot of effort and time into that. All right, looking at old business, our FY20 self-assessment. Vel, do you have some updates to share on our self-assessment at this time?
Yes, I do. It was completed on yesterday and submitted on yesterday. And our self-assessment is basically where it's just questions to assess how we did this year on each of our programs. So if you remember our annual plan, the annual plan at a glance, it's pretty much all of those programs and services listed. And it just asks you, was this program implemented? fully, partially, not at all? Did the collaborative do what they said they were going to do? Did you fulfill your part in the program? So they asked for all of those questions. For the most part, anything before December 31st I would say February, anything before February of this year, it was pretty much fully implemented, because like our back to school rally is from July of 2019, not this year. So our back to school rally in 2019, it was fully executed. Our backpack program was fully executed. So anything before February was fully executed. After February, a lot of things were partially executed, or not at all. Like our Prevent Child Abuse Awareness Month activities, that was not implemented at all because everyone was shut down. That was right in April, so we did not implement that. But it gives you a place in the note area to ask you why it was not implemented, and it was basically due to COVID-19 restrictions. We were not able to implement it. Another thing that was not implemented is the team maze, which is in our plan as well, again, due to COVID-19. So most of everything that we were not able to implement was due to COVID-19 restrictions. Some things that were not implemented fully was Project Free, which I put COVID-19 concerns. I think that was the main reason, but they had not did a program serving our families throughout the entire year. They had finally got one scheduled for March, but it was actually due to COVID-19 that it was canceled. I'm not sure how many families they had enrolled there. Trying to think of anything else. But anyway, that was 80-page report that had to be completed, but it was completed by yesterday on time. Yesterday was the deadline, so I was able to get it in. But that's pretty much the overview of what it was. And there's a way for us, I'm trying to find a way to how to condense that into like a one-pager, so I can share it with you all and with partners kind of what we did, because I know no one wants to read through an 82-page report to figure out how things went. But I want to do like a one-pager, I love one-pagers, so that we can see kind of how we did. And it's for us to look at as we go into FY21, how did we do, what changes could we have made to have done better, and what things that we can do to strengthen what we're doing. So it's for us to look at it, to gauge and make new strategies and plans to continue the work that we do. So I'll try to get that to you all sometime within the next month, I would say.
Thank you for that, Veldy. And just as you said, kind of that one-page snapshot of highlights and then opportunities would be great to share with the collaborative, so everyone can really see how they fit into the overall wealth and health and operation of the collaborative. So thank you for that. The next on the agenda is executive session. I don't know if there are any items. Leanne did not privy me to any updates that were needed to be held in executive session, and typically that's where we discuss matters of HR concerns or anything of that nature. So if Veldy hasn't been causing any trouble.
Can I ask another question?
Yes, sir, Dr. Myers.
Veldy, we were scheduled to have some sort of review for parents as teachers. Is that still in the process, or did COVID sort of take that away as well? Were we doing some kind of
remind me of what you're.
It was some sort
remind
of
me what you.
From the head organization for parents as teachers. Weren't they going to do some sort of review or certification or something?
Yes, we are actually in the midst of that right now. What it is we are a model affiliate for parents as teachers, and what the goal is, after you've been that for 2 years, what they do is prompt you to become a blue ribbon affiliate. So basically what they do is it's a big extensive process where they come in and make sure you have all policy and procedures written down. They look at every aspect of what you're doing in order to give you that blue ribbon affiliate. And so there's a self-study that we will actually kick off in this month, where we will be doing a self-study, providing our policy and procedures. Pretty much we're doing everything, but with this, it has to be a written, documented, everything in this nice little package that we've done, crossed every I and dotted every I and crossed every T. And it goes through April. So it will be a pretty intensive process, but our state office is going to help us walk through it because this is a national certification that we are going after. So, and I will keep you all updated and posted of what the process as well.
That sounds good. Really
Okay.
good.
Thank you.
All right. If there isn't any other business or any other discussions that we need to have, I just want to say thank you all again for being present this morning for the meeting and allowing us to conduct the business. And the last motion we'll entertain is one to adjourn. And I hope I don't have to pull arms to get anyone to give me that motion.
I so moved.
Thank you, Dr. Myers. May I have a second?
I'll second.
Thank you, Pamela. Any discussion or question about the motion? Being none, all those in favor, may I hear an aye?
Aye.
Aye.
All opposed, same sound. All right, the motion has carried. Thank you all so much for your time this morning.
Thank you.
Vildi, I'm sure we'll be sharing minutes from the meeting just as a recap, so everyone will be reminded of our discussions, and so Leanne will be aware of what took place in her